Hi everyone, I am Michelle Taylor, the psychiatric nurse practitioner here at CBHA.
Hi everyone, I'm Elsie Garza, mental health counselor here at CBHA.
We're here to talk about some questions regarding appointments that I think a lot of us have. So I'm going to start with a lot of I think everybody's wondering, are we still able to make appointments to be seen?
They are, so we don't want anyone to not receive the services that they need at this point. We are having to modify the services somewhat in certain situations, but we are still seeing patients in different capacity, but we're able to see them. So if you feel like you still want the service, you still need counseling or psychiatric services, please call us and then we'll give you different options about what is available for you.
Right. You know, given the stay-at-home order from the governor, I think that everybody is really worried about going out in the public and what could happen if I go out. So yes, we do want everybody to stay home if possible. So we are offering other kinds of appointments aside from your normal standard clinic appointment, right? We're going to be doing some telehealth appointments.
Yes, so in order for us to stay protected and for you guys as well to stay protected and not expose yourself to contamination, we are offering telehealth visits over the phone or through video to be able to still get you or your family the services that you need.
Right. Yeah, we just want everybody to stay safe. So the type of appointments that can be done are there's nothing different, really. So whatever your need is, or whatever the need is, I should say, we can address it in one way or another. So if anybody is feeling like they're struggling and need somebody to talk to, or some other kind of help other than medical help, we are definitely here to fulfill that need.
Yes, we want to support you in any way that we can. Just because there's certain things going on doesn't mean mental health issues go away. So some of those things may still be happening for you or someone that you know. So we do want you guys to be aware that we are offering our services. They do look a little bit different for the time being, but we still want to be here in order to support you and in whatever capacity that may be.
Mm-hmm. Exactly.
A lot of patients also, Michelle, are probably going to be asking, am I still able to get my medication? Is that still something that me or my family have access to? So
yes.
How does that work right now?
Absolutely. I don't want anyone who is currently taking medication to go without, right? Nobody in the clinic, none of the doctors in the clinic, if you're taking medication of any kind for any reason, want anyone to be without their medications. So yeah, we can definitely, there are definitely some workarounds and we can definitely connect and get medication refills. The kinds of appointments I might want to see in person or do a video conference with are people that are feeling very acutely symptomatic, so very, very anxious or very, very sad. And anyone I don't know, no one I've made if I haven't met someone before, it's hard to assess and arrive at a medication if necessary without being able to interact with someone in a face-to-face capacity of some sort.
Right. So just being able to see the patient, ensure the symptoms are the symptoms that are actually happening, see what they're going through, and then adequately be able to prescribe something that actually works.
Mm-hmm. Yeah, because a lot of times if I say I'm anxious, right? I can tell you I'm anxious right now. Do I look anxious?
Right.
No.
Right.
But I am, because I'm on camera, right? So that says something about it. So how well is somebody handling the anxiety? Are they able to keep their composure? Are you able to think clearly? That kind of thing. So it's good to be able to see someone's face and their body language. Just as people can tell more from me by being able to see my expressions, my body language, things like that. Yeah. So I think it's more of a personal connection that really does help with making a diagnosis and arriving at treatment options that everyone agrees upon.
Right. So when we're seeing someone for the very first time, it's really important to get a bigger picture. And so that's what we're saying. If medication is a need for you and there are symptoms that you feel are not being handled the right way at home on your own, let us know. And there are different things that we can do to ensure that you're getting what you need.
Exactly. Exactly. So one of the other questions that might be, floating around out there is this going to be a permanent thing moving forward? And I can't answer that. We can't answer that. We're doing what we need to do right now, given the circumstances of the stay-at-home order and the social distancing, just trying to keep our community as safe as possible, but still provide the services that we all need.
Yes, we're trying definitely to stay in the moment, stay present, ensure that our families and the community gets what they need from us. And if that means telehealth for right now, then that's what we're going to focus on. So questions about the future are really hard because we don't know exactly what it's going to look like in the long term. So right now we're really focusing on in the moment, how can we get our patients and our families what they need?
Yeah, but the expectation is that once the risk of infection is managed, right, and it's low or gone, that we will go back to business as usual. And most definitely would prefer to be able to sit down in a room and connect with each other.
Definitely. I think all of us are really excited to get to the point where we can see our patients once again and connect with our family. So for right now, we're doing what we can, and hopefully in the future, we will update you guys on different changes if those come to happen.
Right. And for anyone who feels like that they can't be home for whatever reason, to be able to talk to somebody, you don't feel comfortable talking to somebody with family members around or other people around, we can make accommodations here at the clinic to ensure that the services are available to anyone in a safe and secure, comfortable manner.
So as long as you're willing to assume some risk, we are willing to make accommodations in order to see you the best way possible. So please let us know if you do feel super uncomfortable or not at ease with a phone call or a video call from home. We still want to work with you. Let us know whatever may be going on, and we're here to work with you. So just let us know, because we really do want to continue to offer the service if it's needed.
Right.
I just want people to know that we're still here. We still want to see you. We still want to help in any way that we can. So telehealth is the option right now, and it may look different, so it may be weird, but we assure you that the service and the conversations remain the same. We just want to make sure that you're getting the support that you need.
Absolutely. Absolutely.
All right. Thank you so much for watching this video.